Democratic Visions is handmade in Eden Prairie and Minnetonka by DFL Senate District 42.
Let's turn, though, to the big issue before us, the one that you mentioned that you were hearing about at the state fair, and that is reforming health care. Something's going to happen, I presume. There are portions of that bill, whatever the bill final shape is, that I think must be generally acceptable to everyone except the most rabid, like pre-existing conditions. Isn't that something that most senators could find their way to support, where you cannot preclude a person from getting insurance because of a pre-existing condition?
Yeah, you know, as I campaigned around the state, as we both campaigned around the state, we heard stories about people who were denied coverage because their kid had something, or people who felt stuck in a job because they had a pre-existing condition, and if they wanted to start a small business, but they couldn't because they could never get insurance because of their pre-existing condition. I had a woman, I think in her early 60s, I'd guess, who came up to the booth yesterday, and when I was at the booth at the fair, who said, at my age, everything's pre-existing, which I thought was a great line. There's also, I think,
lifetime caps.
Lifetime caps and yearly caps. So in other words, so many people go bankrupt in this country from a healthcare crisis. Over half the bankruptcies are from a healthcare crisis. And over 80% of the people who go bankrupt because of a healthcare crisis have insurance. And what every bill that's been passed thus far, the 3 in the House and the 1 in the Senate, say is that won't happen anymore. Because what happened is that insurance companies could put a yearly cap on how much money they could spend on you in a year, and after that it's all you. And the same thing on yearly caps. And so I think people agree on that. The question is, I think also they agree that preventive care should be paid for, and there shouldn't be co-pays for preventive care, I think. There's a lot that we agree on. The question is how to bring the costs down.
Well, tell me, how would you suggest we can do that?
There's a lot of ways to bring the cost down. And
I mean, you know, the typical, and I'm not saying this is you, but I mean, you see everybody running for an elective office are going to eliminate fraud and waste. I mean, we got to be talking more than that, don't we, when we talk about how we're
I don't think
to...
it's eliminating fraud, waste, and abuse.
Yeah.
I mean, that's what they always say, fraud, waste, and abuse. Well, this is very complex, but there are some basic principles. First of all, in Minnesota, we do this a lot better than they do it around the country. The
New
rest
York,
of the country,
Florida,
yes,
in particular?
especially. And when you talk about, this is why Amy Klobuchar and I and the rest of the delegation signed a letter saying that we have to change the way we do Medicare reimbursements because we get punished for doing this well.
But is that practical? Is that going to happen? Because you're going to be, in effect,
well,
diminishing
that's
New York
another
and Florida.
issue. But let's talk about bringing the cost down. Let's compare McAllen, Texas to Mayo Clinic. McAllen, Texas, 3 times as much per Medicare patient as the Mayo Clinic. Mayo Clinic gets better outcomes. Now, you could say, well, McAllen, Texas has a different demographic. It's a border town in Texas. Well, so is El Paso. El Paso does it for about half the cost of McAllen. Why is McAllen so expensive? Well, the doctors own the hospital. They
own the imaging equipment.
They own the imaging equipment, and they have a culture there where they look at the patient as a profit center. In Mayo, the doctors are salaried, and doctors are rushing to get to Mayo. So what happens is, in McAllen, because of the way we incentivize doctors not to keep their patients healthy. Doctors actually get more money if their patients get sick. I mean, it really is true. We have sick care. You know, you don't get paid to take care of a diabetic's chronic condition, but you do get paid to remove his foot. In McAllen, if a doctor does a procedure with a patient and the patient calls the next day, the doctor tells the nurse, have the patient come in, because Medicare doesn't reimburse for a phone call. It does reimburse for an office visit. There are best practices. There's so many different ways that we can lower costs. And we've done it in Minnesota. Now, I just met with the head of Blue Cross Blue Shield here, and great guy. He's new to Minnesota. He came from New Jersey. And I've been meeting with Minnesota public health people, providers, health economists, doctors, insurance companies, all these. And I've been just amazed at how dedicated, smart, compassionate, passionate these people are. I asked them, I said, you know, and then I thought to myself, well, wait a minute, maybe healthcare people are like that all over the country. So I said this to him, and then I said, are they like this in New Jersey? And he went, no. He went, no. What we have to do, if we did everything the way we did in Minnesota, we could pay for this like that. So a lot of this is about finding a way to institute best practices, to pay for preventive care, to incentivize the kind of care that actually keeps people healthy.
Well, talk about cutting costs. What is your position on the flashpoint of the public option?
I think a public option will create competition for private insurance. I think that's one of the main reasons to have it. That is the reason to have it, and also to institute these kind of best practices. You know, I don't think that this is not government health taking over the health care. There's a lot of misinformation that's been put out there, and a lot of misunderstanding. I think I saw a poll the other day that said 69% of Republicans say they don't understand Obama's health care. It was more than 50% of Democrats. That's why I'm looking forward to Wednesday's speech.
Sure.
Also, I mean, we have the situation where we have 3 bills in the House and 1 in the Senate, 1 yet to come in the Senate. So this will get clarified, I think. But one of the parts of August that was not so great was the disinformation that was deliberately spread, like the death panels.
Right.
And that was so egregious. Like the other day at the booth, we had about 6 members of the Tea Party there who were there when I arrived, and they were kind of, you know, it was contentious at first, but we calmed everything down and had a very good discussion. And at one point, like 45 minutes into this, somebody, you know, talked about the misinformation that had been spread, and a Democrat or a supporter of mine, and I said something like, yeah, well, the most egregious, I think, was the death panels. And every member, I think it was every member of the Tea Party that was there, nodded their head.
Really?
And they knew that this was, and I said, look, this is really complex stuff. And the last thing we need is someone injecting disinformation that's designed to engender fear. And everyone agreed. And I think that was a very, we ended, this whole thing was really a nice discussion. Right. I didn't necessarily convince these folks of my point of view or that they would be for the public option, but they came away really believing that I cared about the cost. One of them said, how are we going to pay for this? And I said, boy, is that a good question.
Sure.
And I started going into kind of the stuff I was talking to you about.
I want to just conclude by saying, in my estimation, Minnesota is going to be incredibly well served by your service in the Senate. And
well, we're doing this together. You know.
Well, then
but he gets to be senator.
I heard that before. That's a good line. And I think everybody out in this area are incredibly enthusiastic about your serving for us in Washington. Thank you very much for showing up.
Thank you so much.
Franken,
Thank you.
Nice to meet you.
Thank you. Pleasure.
Thanks.